Okay, good afternoon. So this is your last lecture for ultrasound. So we have diagnostic, or the last topic should be the clinical ultrasound. So humana ta sa introduction, and then also the physics of the ultrasound. So we proceed to clinical ultrasound. Okay, so just a basic review of the machine, no? Kung nalimot mo sa itsura. Okay, so this is some of you have been rotated in Sabal Hospital. So this is the setup for the hospital, the Sabal Hospital nga ultrasound machine. So you have here the sorry, we have here the monitor in which the image will be displayed, and then the keyboard, then the console niya, the whole of the console niya, along with the keyboard, and then kani siya ang mouse, and then some of the annotations dayon niya that will be displayed if ever the radiologist would want to display the annotations in the image. And then we have one, and then two, and three transducer. No? Pinaka-common when it comes to the clinical setting. The number of transducers is most commonly 3. And then these transducers is connected towards the hard drive, towards the CPU sa ultrasound machine, and then this image is enlarged. Siya. Okay. So these are the connecting na drives for the individual na mga transducers. And as you can see, there is an annotation here to what frequency is being used. Like for example, this is actually number 1, this is number 15. So that is the frequency niya kung as repeat na to ang white na portion. So 1, 15. Okay? So that means that the white portion is directed towards this one, directed towards the number 1. That means this is a low frequency na transducer. And then for number 2, the second transducer, and then the third transducer, the central the white portion is directed towards the center. So that's approximately nasa mga sa mga 10, in between the 5 to 10 megahertz. So that means padulungan siya sa high frequency nga diagnostic ultrasound. So this is low frequency, and then these are high frequency na probes. Diba? When we talk about the low frequency na probe, this is the low frequency na probe, the curvilinear, and then the high frequency, we have the linear and then the endocavitary na probes. Okay, so just magnify the image. So we have here the 3 probes. We have the endocav, we have the linear, and then the curvilinear. And of course, the gel or the transmission gel, in order for the ultrasound to be transmitted towards the skin of the patient, and of course to eliminate air in between the transducer and then the patient's skin. So it could be that the gel, the transducer gel or the ultrasound gel, will be placed in the face of the transducer, the footprint of the transducer, or it could be directly applied to the skin of the patient. Okay. So if ever we will scan the patient, for example in this image, so this image will be presented as a slice. So that means this the liver of the patient, this example, this is the liver of the patient that is being scanned. So it's almost like a transverse image. If we put this in the CT scan modality, no, it will produce an eggshell view of the organ, or like eggshell slice of the organ. Okay, and if the transducer would be placed in this position, so that means sagittal ang iyang cut nga ma-produce diri sa image. So kani siya, this is an almost oblique, no, pero that is supposedly transverse nga production of image. Tapos kani siya nga position sa imong probe will produce a sagittal, kaya diba Ang iyahang form sa imuhang transducer karon is mura niyang i-divide ang body into left and right nga portion. Okay, right and then left. Well, kani pag ingani ang position sa ato ang transducer, so we are dividing the body into superior and inferior. Diba? So that means axial nga cut. And then kani is sagittal nga cut. Okay. Or sagittal view. So just example images. Now we have here the liver, no? The liver, and then the kidney. And in this image, we also have here the urinary bladder. So as mentioned yesterday, now we have discussed topics about the artifacts related to ultrasound. So as you can see in these images, na mga production of artifacts. Kani sila, di ba, na production of artifacts. Also in this image, na production of artifacts. But since this organ is fluid filled, most commonly, pag na-fluid filled ganing mga structures, it will produce mga ani acoustic enhancement. Also this, since na very reflective nga part dere, that is the outer layer of your or the covering of the kidney, since specular siya nga reflector, kay smooth man siya, so sometimes it could create artifacts. Okay, so important factors to consider during an ultrasound examination or any type of examination. Okay, for any type of examination, important factors to consider, we have first the patient preparation. And then second is the patient history or the chief complaint of the patient. Of course, it's always necessary if ever the preparation or if ever the ultrasound examination requires preparation, or if ever no preparation is required. Okay, there are some examinations that does not require examination. Like for example, the scrotal examination, the breast examination, thyroid examination, but they do not require any preparation. While the preparation or examinations that require preparation are especially those atong hepatobiliary system or those atong abdominal nga cavity in which they are filled with since the abdominal cavity has the intestines, and then the intestines can be filled with a lot of gas and then a lot of fecal materials if ever we eat something. So that means we need to expel those materials in order for the organs to be well demonstrated. So next, letter B, we have good images of internal organ. So in order for us to provide good images or quality images of the internal organs, if ever na siya preparation, no, dapat naagi proper preparation ang patient. For example, fasting for 8 hours or 6 to 8 hours. So that protocol should be followed by the patient, and of course should be instructed by the rad tech properly. Para si patient, he would understand the consequences if ever the patient would not be prepared enough, no? Okay, that would result to that can result to a misdiagnosis of the condition of the patient. Okay, and then of course we also have to consider the evaluation criteria for evaluations for the different examinations. For example, the size of the organs, the location of the organ, and then the origin of the different parts of the organ, so that if ever you are the one who is scanning the patient, then it is easier for you to locate the different organs and then their origins if ever you are tracking a part of the organ from its superior portion or from its proximal portion towards the distal portion of the organ. And then of course you have to know the different sizes, the normal sizes of the organ, so that we can diagnose if ever there is an increase in the size of the organ or maybe a decrease in the size of the organ. And then most importantly, since we are dealing with ultrasound, so the overall texture should always be evaluated. Okay, so in the Philippine setting, no? Very rare kaayo nga si Radtech ang mag-scan, except siguro sa Manila kana nanagid sila mga ultrasound na technologies. But for the Visayas and Mindanao na locations, it's commonly the radiologist who does the examination, but dili kayo kita ang ga-examine, even though a lot of Radtech already know how to scan. Pero since there is no certification, there's no proper training for uh, the ultrasound scanning, so wala pa certified yun. Okay, except dito sa Luzon, like uh, for example sa St. Luke's. Okay, so to St. Luke's, there are Radtech already na they are the one who will scan the patient. So that means they are considered as a registered sonographer. So Radtech slash sonographer. Okay, so it can be a male and then it could be a female nga Radtech. Okay, so it's not only limited to the female actually. Kaya nagyapon tayo mga male nga ultrasonographers. Okay? So echo texture, di ba katong na-mention na ito gahapon, what are the echo textures? Or that's basically ko atong i-define sa basic nga words, they are the colors nga makita na to sa ultrasound. So echo texture, that is how similar the shades of gray within an image, similar shades of gray within an image are to each other. Sorry, that's only one O, are to each other. Okay, so we have different types of echo texture. Katong mention gahapon, diba, we have the anechoic, we have the hyperechoic, we have the hypoechoic nga mga regions. Okay, so we have the homogeneous na echo texture, and then we also have heterogeneous na mga echo textures. So if we have an ultrasound image there, for example, sa atong screen, a homogeneous na structure is where all echoes are of similar gray. So that means all of the structures sa imuhang organ are of the same color. They are of the same grayness. No? They are of the same shade of gray. If they are heterogeneous, then that means in your screen or in your organ, there are a lot of different echoes. Okay, so na ay part sa imong image that it appears very white, no? Or maybe very dark put sa dang uban, or some of the areas is at the gray level. Okay, so first we have the sonolucent or the echo-free na mga structures, black. We also call this yesterday as anechoic. So there's just a similar gihapon na silang mga kuan na mga structures and then terminologies. And then we have echogenic, that means daghan kaayo sila og signal, that means daghan kay siya echoes nga gibalik dito sa transducer. That's why they appear as white. Or diba, pwede po na siya i-term as hyperechoic. Okay. And then we also have heterogeneous, in which all the echoes are dissimilar. We have that wala na as diha. Sonolucent, intermixed with echogenic particles. Like for example, in a complex mass. No? In a complex nga mass, that means na siya fluid sa iyang sulod, napod sa siya solid nga material. So that is a complex nga mass, combination of fluid and solid nga mga masses. And then echogenic, with strips of areas of sonolucency, that is heterogeneous. So most commonly sa atong mga heterogeneous nga mga tawag ani masses are those complex nga masses. Kaya diba, we have cystic nga mass, in which most commonly sulod niya is fluid, and then we have solid nga masses. Now we have cystic and then solid nga masses, and then the combination din nilang duha, the combination of the fluid and then the solid, if ever, for example, the mass contains solid and also fluid na mga contents, so it is defined as a complex nga mass. Okay, so we also have different criteria for our masses. Katong na-mention ako, di ba, we have the cystic nga mass, and then we also have the solid masses. So again, if ever cystic ang mass, most common niya nga sulod is fluid. Okay, fluid, while the solid, of course, solid nga masses. So maybe na ay, for example, daghan kay siya og tawag ani, kanang gikan siya sa isa ka cellular body, and then that cellular body can increase og ayo, like for example a new growth or a tumor. So that means isa ra siya ka part. So it's not a like a cyst nga fluid ang sulod, but rather it is a solid nga mass. So dili po siya solid nga like for example stone, but rather solid siya nga mass. Okay, new growth na siya, dili siya considered as a stone. Okay, lahi po ang stone nga formation. Okay, so if ever we have cystic masses, most commonly ang ilang appearance in the sonograph na image, it has an echo-free center. Okay, since fluid man siya, diba? Kung as you have observed sa atong mga previous nga lecture, if ever na ay fluid ang sulod sa ato ang organ, what happens is it will become somewhat anechoic. Now, there are no echoes that is being transmitted back towards the transducer. Okay? So, diba, for example, the urinary bladder, diba? The urinary bladder, ang ihang common appearance is black. So, that means anechoic na siya. Okay, so that means there are no echoes that has been reflected, or basically, it has an echo-free center. And then for number 2, it has a smooth, well-defined borders. Laban ng mga cyst. And then for number 3, we have increased amplitude of echoes. So that means amplitude of echoes most commonly labaw na sa iyahang kuan. Labaw na sa iyahang posterior niya nga portion. Okay. Posterior portion niya. Di ba kabantay mo pag na-fluid, most commonly ang kakahitabo is naaday production of the acoustic enhancement. Katong mo puti og ayo ang iyahang posterior portion because of the transmission of ultrasound beam. So next we have the criteria for solid masses. So compared to the cystic masses, if the cyst, or if it is a cystic mass, it has an echo-free center. Kung may patag solid nga mass, then naa siya mga internal echoes. Okay, internal echoes, that means na ay echoes sa sulod sa imuhang mass. Kay solid man siya, di ba? Compare niyo mo dito kan cystic nga mass in which fluid ang iyang sulod. So that means wala kay signal nga gabalik sa transducer. That means anechoic, no? Na siya anechoic. Okay, and then number 2, irregular and poorly well-defined wall. Compared nimo aning well-defined borders. Smooth and well-defined borders if ever cystic ato ang mass. And then number 3, for low amplitude nga echoes, again this is for posterior gihapon siya. Okay, so kani siya increased amplitude, di ba? Kani siya kay low amplitude of echo. So kani siya would most commonly create na acoustic enhancement. Acoustic enhancement. Because kani siya, it will cause the solid, it will cause acoustic shadowing. Okay, sample acoustic and enhancement. And then isa, acoustic shadowing. Okay. So we have here examples. So this is a cystic nga mass. And then this one here is a solid mass. And then another complex nga mass. Okay, so as described, no, it has a well-defined wall. Mugid ni ang iyang border siya. And then it has an echo-free center. That means black or anechoic. Anechoic. So, diba? Echo-free ang center because, again, this center or this mass contains fluid, and ultrasound best travels in water or fluid. And then we have here the solid mass, diba? Na ihang wall, paabot diri kay medyo corrugated na ihang walls. You don't really know which is the border of the wall of the solid mass. No? If dili siya well defined, if ever kanil lang ba siya ang border diri, or maybe this part is still also included in the solid mass. Okay, so as described, no, compared diri nga anechoic, so naa siya yung mga uh, slight nga mga echoes, medyo grayish ang iyang mga portions, iba na hypoechoic nga mga portions. So that means that inside of this border, inside of this mass, there is solid na particles. Na siya mga solid nga part dere. Okay, so the whole of the mass is solid. No, that's why they reflect echoes. No, that's why they reflect echoes towards the transducer, and they are formed as an image. And then for the combination of both, let me see. Now, when you compare cystic, the whole of the organ, the whole of the cyst is almost black, na anechoic, while the other one, ang yahang whole of the mass is almost gray, diba? Almost gray tanan. While the complex nga mass, there's a combination of, diba, na fluid contents, while some of the parts contains solid contents. No, so naa siya fluid at the same time na po siya solid nga particles. So both of them in one mass, that is the basic description of a complex nga mass. So that means, for example, na abscess na mga dead particles, so that is a complex nga mass.